Hello, and welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie Herodopoulos, and today we are discussing celiac disease. Lately, many of my patients have been asking about gluten-free diets, and May is National Celiac Disease Awareness Month. Gluten has received a lot of immediate attention, so what's all the hype? Well, it turns out a lot of people have problems when they eat foods that contain gluten. Approximately 1% of the population, which is about 3 million people, have celiac disease. Celiac disease is a condition that damages the lining of the small intestines and prevents absorption of nutrients in food that are important to staying healthy. The damage is due to an autoimmune reaction to eating gluten, and this is found in wheat, barley, rye, and some oats. Some common foods that contain gluten are pasta, bread, cookies, ice cream, and beer. I know what you're thinking, all the good stuff. It can also be hidden in many processed foods, such as frozen French fries, hot dogs and sausages, soy sauce, salad dressing, and ketchup. The exact cause of the disease is currently unknown. It could develop any time in life, from infancy to adulthood. People who have a family member with celiac disease have a much greater chance of getting it. And the symptoms can vary from person to person. So this is why many of the diagnoses don't always happen right away. The disease causes problems with the gastrointestinal tract, and this can lead to bloating and gas, diarrhea, and abdominal pain, even constipation, nausea, and vomiting. Since the intestines do not absorb many minerals and vitamins with this autoimmune disease, symptoms of malnourishment can occur. Also, patients with untreated celiac disease have a much higher risk of intestinal cancers, anemia, osteoporosis, and even miscarriages. Celiac disease can be diagnosed by blood tests that check for gluten autoantibodies. These tests are only accurate if the patient is currently eating a diet containing gluten at the time of the blood test, so it's important to not stop eating gluten until you have these blood tests done. In the event that the clinical signs and laboratory blood tests are positive, then definitive diagnosis is made by obtaining biopsies via an endoscopy by a gastroenterologist. Celiac disease cannot be cured. However, the symptoms will go away and the intestines will heal once the patient follows a lifelong gluten-free diet. And this includes not eating beverages, foods, and medications that contain wheat, barley, rye, and oats. Reading labels to carefully look for hidden sources of these grains is imperative to achieving optimal health. Gluten test kits can be used at home to check for gluten contamination if you are unsure. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health News section.